Well, as in most things in life, change management is mostly hampered by our desire not to change. It's something inherent. And the more specialist the profession, like the doctors, the more resistant in general they are to change. Because the more processes and systems have been built around it. And let's face it, our healthcare systems in Europe have been built as a consequence of the Second World War. And the purpose was to do as good for the health of as many people as possible. And around that we built all kinds of processes and systems. And to do what we now need to do, you need to fundamentally put a question mark around those. Discussions starting that physicians and nurses, anybody in the healthcare system, should not be paid for just the action of seeing us or for the test, but for actually the impact on our health. So then you can understand that the hospital now becomes very conscious to not to do too many testings, to make sure that when a medication is prescribed, the patient actually takes it, because otherwise it ultimately changes their revenues. And we see that that is beginning to happen everywhere. People are being responsibilized for the outcome. And in the end, that's also what the patient wants, a certain outcome. In the beginning, PFMD, like most any coalition of this kind, is in essence a coalition of the willing. And we can do two things. We can either try to convert the unwilling into willing, or we can say, you know what, let us, the willing, already start working together better. And I think that is the first goal of PFMD. We are already representing different organizations who, by just collaborating between us, can already have a very important impact and improve the situation for medicine's development and for better solutions for patients. So I would not try to boil the ocean. I would not try to save the world in one day, but we start with ourselves. That's the best way. And I think we have around the table in PFMD the right players to really make a good impact quite quickly.